Exercise 30 deals with the anatomy of the heart. So we're going to look at both the external anatomy as well as the internal anatomy. The heart is a pump. It's basically a two-sided pump. The left side is going to be pumping blood to all the tissues of the body except for the lungs, because the right side pumps the blood to the lungs and back. On average per day, for the average individual, it's about 100,000 beats, and it's moving between 7,000 to 9,000 liters. So it's working pretty hard. The pericardium is this membranous sac that is enclosing the heart. It's helping to protect it, helps to reduce friction. You have basically two layers. The parietal pericardium covers the inner surface of your pericardial cavity, and the visceral forms the outer surface of the heart itself. There are four chambers of the heart. The two upper chambers are a little bit smaller than the lower chambers. It's located in the mediastinum, which is the pericardial cavity. It kind of looks like an inverted pear. It's about the size of your fist. So this is showing the front view of the heart, the anterior view. You can see all the various blood vessels that are associated with it. We will go over all of those. And then the posterior view. We'll start with the external anatomy and then move to the internal anatomy. The base is, it sounds backwards, is actually across the top of the heart. It's the broadest region, and the apex is the point, which is actually at the bottom of the heart, pointed more towards the left side of the body. Those four chambers that you have, you've got the right atrium, the left atrium. The atriums are the upper chambers, and then the ventricles are the larger chambers on the bottom. You have the right ventricle and the left ventricle. Remember, when you're looking at the diagram of the heart, that it's always left and right is always the patient's orientation. There are different grooves or indentations. You have the coronary celsus. This is a groove that's basically surrounds the heart between the atrium and the ventricles. In this coronary celsus is where you're going to have your coronary arteries located, the left coronary artery and the right coronary artery. And then there is also another indentation or celsus that's called the anterior interventricular celsus. As the name implies, interventricular, it lies between the left and the right ventricles. On the posterior side of the heart, there is a posterior interventricular celsus as well. And once again, you'll notice that the major arteries and veins do tend to lie in these celsus, in these grooves. We'll now look at the larger blood vessels. We'll start with the superior vena cava. It is draining blood from the upper regions of the body, the brain, the neck, the upper arms, except in the thoracic area, draining it into the right atrium. The inferior vena cava is coming up from the lower portion of the body. It's draining everything below the diaphragm and returning it also to the right atrium. What you do not see on this, and we'll talk about in a bit, is the coronary celsus is also draining blood from the heart muscle itself, returning it. Blood returning to the heart is going to come into the right atrium. The pulmonary trunk is carrying blood coming from the right ventricle, and it is going to bring it to the lungs. Now, your veins are returning blood to the heart, arteries are moving blood away from the heart. The pulmonary trunk is carrying deoxygenated blood. This blood has been throughout the body, and it's been returning by the superior vena cava, inferior vena cava, and so it's going to be very low in oxygen, which is why in this picture it's colored as blue, and it's very high in carbon dioxide. So that pulmonary trunk exits from the right ventricle, and it is immediately going to split to the left pulmonary artery going to the left lung and the right pulmonary artery going to the right lung. Once the blood has gone to the lungs, you have the gas exchange that occurs there. So now the blood returning from the lungs has been oxygenated. It dropped off the CO2 and it picked up oxygen. It is going to return to the heart. From the right lung, it's returning by the right pulmonary veins. From the left lung, it's returning by the left pulmonary veins. All four of these veins will flow into the left atrium. You'll notice a couple of things that are marked on here. And one thing is the Ligamentum Arteriosum. This is a piece of ligament. It's attaching from the pulmonary trunk to the aorta, specifically on the aortic arch, right above it. Yes, it's helping to hold it in place. This is a leftover thing from fetal development. During development of the fetus, the developing fetus gets oxygen from the mother. The placental blood vessels or the umbilical arteries and veins are supplying nutrients, gas, and getting rid of waste products. So they supply the nutrients and gas from the mother. The lungs are non-functioning, so you do have some blood flow going to the lungs just to maintain the development of the lungs, keep them alive. However, they're not functioning in gas exchange. And so in the fetus, when blood is leaving the right ventricle and it comes up through that pulmonary trunk, right there, there is basically this connection where it's a shunt or a bypass. Blood can flow through what it's called the ductus arteriosum. So it can flow from that pulmonary trunk directly to the aorta. At birth, this seals up, and the remains or the remnants of it are the ligamentum arteriosum. In terms of the patterns of blood flow, blood is coming from the systemic circulatory system, which is feeding all the body except for the lungs. It returns to the heart by the superior vena cava and inferior vena cava, flows to the right atrium, to the right ventricle, out the pulmonary trunk, through the pulmonary arteries, to the pulmonary circulatory system, or the pulmonary circuit. That's supplying blood to the lungs, where you have the gas exchange occur. It drops off the CO2, picks up the oxygen, returns to the heart via the pulmonary veins. It now flows into the left side of the heart, so the left atrium to the left ventricle, and then out the aorta. The aorta is now going to feed the blood to the systemic circulatory. So it's basically systemic circulatory system to the right side, to the pulmonary circulatory system, to the left side. And it just continues and rotates in this closed system. In terms of the internal anatomy of heart, we see in this slice version, this schematic drawing of the dissected heart, you see the right atrium, you see the right ventricle, the left atrium, and the left ventricle. Notice that the walls, the muscle walls of the left ventricle are much thicker than on the right ventricle. That is because the right ventricle only has to pump the blood to the lungs, which are right next door. The left ventricle has to be able to have a much stronger contraction to be able to push and pump that blood all the rest up to the areas of the body. There are 4 different valves that are associated with the heart itself. You have the tricuspid valve, which is located between the right atrium and the right ventricle. You have the pulmonary valve that is located between the right ventricle and the pulmonary trunk. You have the bicuspid valve, also known as the mitral valve, that is between the left atrium and the left ventricle. And then you have the aortic valve, which is between the left ventricle and the aorta. The bicuspid and tricuspid valves, also known as your AV valves, aortic ventricular valves. The valves are positioned and held in place by the chordae tendae and the papillary muscle. The papillary muscle is attached to these chordae tendae, which keep the flaps of those valves positioned properly, and it also keeps it from flipping back into the atriums. You have various muscles associated in the ventricles and some of the texture of the pectinate muscles that are in the atrium. You have the Interatrial Septum. That is the division between the right and the left atriums. You do have what's known as the fossa ovarialis. This is essentially like scar tissue that's left over. It's another shunt that is seen in fetal heart that allows for bypassing, once again, of blood could flow from the right atrium to the left atrium, bypassing the lungs. But this is closed under normal conditions. This becomes closed at birth. The interventricular septum is this division between the right and left ventricles, and it is a thick muscular wall. Here is cross-section of the band. It's helping to hold together the septomarginal tuberculi of a heart. If we trace the blood as it comes to the heart, first it's going to be arriving by either the superior or the inferior vena cava, depending on whether it's coming from the upper portion of the body or the lower portion. From there, it's going to flow into the right atrium, through the tricuspid valve, into the right ventricle, through the pulmonary valve to the pulmonary trunk. From the pulmonary trunk, it will branch and go through either the right or the left pulmonary artery, going to the lungs. In the lungs, it flows into the pulmonary capillaries where the gas exchange is going to occur. Then it flows from the capillaries into the pulmonary veins, returns back to the heart, and flows into the left atrium. It will flow through the mitral valve to the left ventricle, and then out the aortic valve, through the aorta, into the systemic circulation. There's another part of the circulatory system that's known as the coronary circulation. This is feeding the heart muscle. In this diagram of the heart, we have both the anterior and the posterior view. On the anterior view, you can see that the right coronary artery is going to separate into the right marginal artery branches and also into the posterior interventricular artery. The circumflex artery, as you can see, it wraps around in that coronary celsus. And then on the posterior view, one of the major arteries you see, once again, is that posterior interventricular artery. So as I said earlier, you can see that the arteries and veins tend to line the celsus, and they pretty much circle around and wrap around the heart, supplying that muscle tissue. As you can see here, the left coronary artery, the circumflex artery, and the anterior interventricular artery. In terms of the veins, you have the great cardiac vein. You see how it comes around the celsus, feeds around the front side of the heart. On the posterior side, you have the posterior cardiac vein and the middle cardiac vein. And on the front, on the right side, you do have the anterior cardiac veins and the small cardiac veins. In terms of the heart wall, there's three different layers. The innermost layer is the endocardium. This lines the internal walls of the heart. The myocardium is the middle layer. This is the thickest layer. This is composed mostly of the cardiac muscle that is going to be doing the contraction and actually the pumping action. The epicardium is the outermost layer. It is also known as the visceral pericardium. And in this picture, you can see the schematic drawing of at the bottom. You have the heart chamber. That's where the blood's going to be flowing. And then you have that endocardium. Then you can see the thickness of the myocardium, and then the epicardium, that is the visceral layer. You have the pericardial cavity, and then on the outermost you have the parietal layer of the pericardium. So once again, in terms of the blood flow through the heart, the right side's controlling the pulmonary circulation, going to and from the lungs. Left side's controlling systemic circulation, which is going to all the rest of the body. when the heart contracts, what's going to happen, what we call the cardiac cycle, both of the atriums will contract and relax together. Both of the ventricles contract and relax together. So the atrium contracts, relax, ventricle contract, relax. So you see the upper portion of the heart contract, lower ventricles contract. So once again, this is just reviewing the pulmonary circulation, about how the blood is going to flow to the lungs, and it needs to unload the carbon dioxide and pick up or load up on the oxygen, and then return back to the heart so that that oxygen supply can now be passed through the rest of the body through the systemic circulation. And that is what you see here depicted. There are different clinical manifestations that can be associated with the heart. Pericarditis, anything ending with itis means inflammation, so that is inflammation of the pericardial membranes. That's going to increase friction, and that you're going to feel it. You can have increased fluid volumes that kind of start to inhibit the movement of the heart. Cardiac tamponade is restriction of the cardiac output. That form an overlay, that is that opening in the between the two atriums in the fetal heart. In healthy adults, you see the scar tissue is the fossa ovalis. This allows for, like I said, that shunt or that bypassing of the lungs in the developing fetus. If it does not close properly at birth, then you can end up with a defect there. That's sometimes referred to as a hole in the heart. Sometimes if you give it time, it will seal up. Sometimes it may require surgery. Depends on the extensive nature of it. You can also have ventricular defects between the interventricular septum. Endocarditis is when you have an infection of the endocardium. This can often damage heart valves, which is in turn is going to affect the blood flow through the heart. Congestive heart failure is when you have damage typically to the left ventricle, and what's going to happen is that left ventricle is not able to pump efficiently, and you end up the right side's still pumping, but the left side's not pumping as well. The blood's going to back up into the pulmonary circulation. You tend to have increased fluid in the lungs. Angina Pectoralis is a deficiency of blood flow to the coronary arterial circulation, and the cells of the heart itself become weakened because they're not getting enough oxygen. A myocardial infarction is where you've had blockage and cells are not getting oxygen. The cells actually die. So what most people refer to as a heart attack. The cells that die are not replaced with cardiac muscle. They are replaced with scar tissue. So you will have damage to the heart. Obviously, it's going to be much more dangerous if it's to that left ventricle, which is necessary and so critical for having a strong enough contraction to pump through the systemic circulation.